Hello viewers, welcome to another beautiful day. My name is Aisha Owaideko and this is the Breakfast Show on TSL Nigeria TV.
You're welcome and thank you for joining us. Health is said that to be the best state when you're free from injuries or illness, and good health care is part of government's basic amenities for her citizens. That's why the Edo State government, under the leadership of Governor Godwin Nogegase Obaseki, launched the state's compulsory health care insurance scheme in October 2019. On set with us this morning is Dr. Rock Amego, the Director General, Edo State Health Insurance Commission, as we talk about health insurance, the assets and benefits. Good morning, sir. Thank you for joining us.
Good morning.
Thank you. Thank you so much for finding out time to be here. Now, for one who has no knowledge about health insurance, can you kindly feed us in with that?
Oh, okay. Thank you again for having me. I'm glad to be here. I'm amazed by the work you guys are doing.
Thank you.
It's very beautiful.
Yay!
Thanks for having me here.
Thank you.
So, health insurance is basically, having to pull funds together for groups or individuals so that when a particular one is ill, they can pay for those who do not have money. Okay. It's just like a form of communal living where everybody brings resources together. And so we expect that, looking at other climes in the world where you don't have utilization of more than 30%, we expect that those people, if you have 100 people, not more than 30 people can be sick at the time. So for those, since they are paying premiums of small amount of money, for those who cannot get health service, or for those who do not have money when medical catastrophe occurs, then the pool of funds can be used to treat those who cannot meet their financial obligation when health crisis occurs.
Okay. So being the Director General for the Edo State Health Insurance Commission, how do we narrow it down to Edo State? What are the plans for health insurance in Edo State?
Okay, what we did in Edo State was that we tried to make it an all-inclusive process, and we tried to capture everybody in the society. So based on that, we started developing a law for the health insurance. It started in 2017 and then was assigned into law in 2019. It took about 2 years to work on the bill and the process and policies. So we stratified the society into 5 basic groups. The formal sector where the civil servants work, the informal sector where a lot of people are, about 90% of the population, students plan, equity plan for those who cannot pay, who are vulnerable, those in society who do not have work, who are probably disabled, just like people who have leprosy, those kind of groups fall into that plan. And then of course the enhanced plan. So if you look at those 5 plans, basically they cover for every person in society. It gives you room to participate in health insurance, whether you have funds or you do not have funds, whether you are employed or you are not employed, irrespective of your location, your income, your gender, you are entitled to health insurance in Edo State. That's what the governor is doing. That's what we're launching this month.
Okay, thank you very much, sir. Now, since 2014, the federal government established NHIS for every citizen of Nigeria, and now we have Edo State Health Insurance. Can you tell me why Edo State Health Insurance why the government is now bringing Edo State Health Insurance when we have NHIS? Why is Edo State Health Insurance better or preferable? What are the benefits of Edo State Health Insurance to the citizens, to the residents of Edo State?
It's a very beautiful question. We've been going around sensitizing people, telling them about health insurance, but NHIS started a couple of years ago, and then till date they have only about 3% coverage. When I mean 3% coverage, I mean the enrollees they have on their scheme. That's been very difficult to do because it's the same problem we're having in the country everywhere, where we have a federal system, and then people in the center just control what we're supposed to do in the state. It simply would not work. Edo State, for example, is projected to have 4.5 million people by the year 2022. So how do you expect a body in Abuja to control all that great population? We have countries in the world that are not even up to that population, So we needed to decentralize the system, and NHIS will act as a regulatory body in the federal sector, and then we as a state, we meet those within the local government, wards, and then communities so that they can engage in the health insurance.
So is this under NHIS?
No, this is Edo State Health Insurance Commission.
It's separate.
Does it have anything to do with NHIS?
Oh yes, certainly. It's like State Ministry of Health and Federal Ministry of Health.
Okay, so they are related.
Oh yes. It's just like a regulatory body.
Dr. Rock, not because this is your office, I'm going to ask you a very straight question. How well do you think the insurance policy in Edo State is going? Because I think the layman on the street or the average Benin person does not know about health insurance or the scheme. So Is it that there is no awareness, or people or those in this sector are not doing their job as it should be?
No, you see, insurance all over the world is not linear. What I mean is that there are a lot of tributaries that come in. It's kind of a complex process. And so, because we started our own just barely about a year and a half ago.
2019 was compulsory.
Yeah, about a year ago. But you remember we were faced with a pandemic
in 2020.
And the election was also there. So there was a lot of rigmarole in the system, which didn't cause us to have a seamless process. With health insurance, the advocacy never ends. It's a moving target. You know, other countries in the world Kenya, for example, started in 1950-something. England has had it in almost the 1900s, and we're just barely starting. And those are countries that have had data, and so we don't have data. But what we're trying to do is that we're trying to utilize every sector. We're trying to say that if you have to do business with government, then you must get into the health insurance scheme. What we're saying is that for school children, if you are going to the police station, all inclusive sector. So because the law is already there. If you have a staff of more than 5 and they are not under the health insurance, it means you are committing a crime.
Oh, wow.
You know, so what we're doing right now is that before you tell somebody they've committed a crime, they must know about the system. They must know about what you are doing, what the process, what the benefits are. If you go around in those states, you see that our billboards are everywhere.
I saw something. Okay, that leads me. Actually, to my next question, because I've been seeing the people going around saying pay 15 naira, stuff like that. So this is the question for you. What's the plan for those who are working, those who are not working? Is it a daily thing? Is it monthly? There's some people have the mentality that I cannot be saving for sickness. It means I'm inviting sickness. So please let us know the payment plan as well as alongside the benefits.
Okay, you know, when I started, I said we divided it into five yes. And so based on that, we're able to fit everybody into a particular strata based on the division. For those, usually when you keep saying 50 naira, our smallest health plan, if you look at our health plan, is about 18,000 naira. That's where the informal sector
monthly?
Yes, yearly, not
yearly.
Monthly.
Oh, wow.
Yeah, yearly, 18,000 naira. But that informal sector was divided into 3 as well. Informal sector, gold, silver, and bronze.
It's a package.
Yes. We did that based on the income level of every individual or group. So for those who earn less than 50,000 naira, there's a particular package. For those who earn about 50 to 150,000, there's a particular package, and of course 150,000 and above, there's a particular package. That's not to say when somebody comes and say, I want a smaller package because I don't fall sick. You just encourage them that this is the best package to go based on what your health income is. But what that 50 naira means is that if you contribute 50 naira for 5 days in a week, you get 250.
That's true.
And then for a month, you get about 1,000 something, and then for a year, it gets into 18,000. So in our scheme, we also have what we call aggregators. Because of the literacy level in our country, in our state particularly, we have about 90% of people say they've gotten primary education. But we know that internet is a new age, and so a lot of people, before me, do not know how to use the internet. If you can use the internet, then of course you can do a self-serve to get paid on the insurance scheme. But if you cannot, especially for those who belong in groups such as market women, bike riders, we might not be able to meet them individually.
Okay, yes, I was thinking about reaching out to them and how you get your premium.
So what we did was that, I mean, it's almost the same question both of you are asking now. What we did is that we formalized the informal sector. So we brought them into groups. So we have aggregators that broker the business between those groups and our group to say, okay, we're going to be collecting 50 naira. I'll guarantee this sum of money so that you can start giving these people healthcare. Those who can pay monthly, those who can pay daily, biannually, weekly, quarterly, as the case may be, they start paying. And then so what we do is, as a commission, we just regulate the governance structure with which they are collecting the money and remitting to us. Okay,
so Dr. Rock, a quick one here. What if we have someone who's on the, let's say, silver package who pays 18,000 naira monthly, and this person has a serious health issue? Someone who has to go maybe like a kidney transplant or has an heart issue, and the person says, I get insurance. Do you understand? Like maybe a market woman who's going through liver crisis or stuff like that. What's the plan to cover up for such person?
Okay, what we do is that if before you get into the health insurance scheme, we'd like to engage with the people, especially those who are very ill. The reason is that we're trying to prevent adverse selection. There are cases in the world where people have heard that there's health insurance, and they know that a particular package of the health insurance, say maybe hypothetically the informal sector I just talked about, maybe it has two sessions of dialysis, and the health plan costs 18,000 naira. A session of dialysis is about 25,000. So that's 2 sessions in that plan is 50,000. They just come and quickly and say they want to join so that to benefit those two plans. We are not pushing them away because we are an all-inclusive process, but we are saying come with equity, come with a clean mind, come with what you are having. So we can strike a balance, we can have a... Because as a body, of course, as a health insurance company, we have partners, we have philanthropists who come to donate for people. And so we can give you a better deal as to how you can get these benefits at a reduced cost.
Okay.
So for those who, if you see the various health plan, of course, nothing is for free. So the services are capped. But the most robust health plan in all the services is the enhanced that we really didn't talk about. That one has dialysis, it has home visits, so it has a lot of package, but not plastic surgery, of course, because we've asked a lot of people coming to meet us that can we do beauty surgery?
No body contouring.
Yes, so that's not in the plan at all. Maybe in the future, when we get a lot of people coming there, we can start doing that. But for the health plans, we have capped medical services. But that is not to say that if you have a problem, we will not try to come through for you.
Okay, so do you check people to know their health status before they take insurance?
Oh, certainly.
Policy?
Oh, certainly.
Okay, so cases like that, where there's like people that have kidney problems already, so would they still go for the 18,000 naira on?
No. For people like that who have problems, such as chronic diseases like kidney that you mentioned, we advise them to go for a bigger plan. Okay. The biggest plan is the enhanced plan.
What if they can't afford it though?
Well, you know, like I said, we're a social service. You know, we'll come to compromise with what we can do and what we can give to them. We not push anybody away because you cannot afford it. And where we see that we're tied, we're financially constrained, we escalate to maybe a higher body or philanthropists who help us, or even our partners to help with resources. Because medical services are not free. Somebody must pay for them.
That's true.
But we act as a conduit between the society and then the government or the philanthropists who want to come in between to bridge this health gap that these people might be having.
Okay.
You know, so the health insurance scheme is a win-win for those in society. It's a win-win for the government, and because it creates employment. It's a social form of investment. It creates employment for the aggregators. It creates employment for our people who are now learning the process of insurance. It reduces the security gap in society, because I mean, if you see every startup, you see what happens when you don't have the basic needs: education, health, shelter, water, feeding. That's when, you know, criminality begins to increase. But we as a health insurance, we're trying to contribute our quota to reduce that gap in society. You know, where we can now live as equals, we can now live as one, and then productivity can increase in society based on having health. I'm sure you have heard the slogan, healthy nation, wealthy nation. So if you are ill, the participation that you bring to the society, of course, will be preserved, and then people will enjoy the benefits you bring along.
Now, sir, the hospitals we have in Benin now, you know, like some components, they have specific hospitals.
HMOs
like
and stuff.
You know, so for Edo State Health Insurance Commission, the hospitals we have in Edo State, like which do we assess for residents of Edo State for health care? Is it all the hospitals, or we have specific hospitals? Are the hospitals enough for Edo residents?
Yeah, thank you again. I almost feel like you know about health insurance more than a lot of people here. Yes. With health insurance, you cannot engage everybody because you cannot monitor all the services. In Edo State, I don't want to say it unfortunately, but most of the health facilities we're engaging are from the private health sector. We noticed, we did a background surveillance check before we started, and we realized that more than 80% of the population were utilizing private health care instead of government hospitals.
And
a lot of them had apathy towards
is that a good report on your part?
Okay. For Edo State,
yes.
We're thinking Central Hospital, UBTH.
Oh yes. There was apathy towards using a lot of government hospitals because sometimes they said the facilities did not meet requirements, and the decay that happened in the system because of previous government that have left health. But this government has had the greatest political will we have seen in Edo State, and so we are trying to leverage on that to bring us back to the righteous path that we have left in a long time. I'm saying this without any form of animosity to government hospitals. Our hospitals are not all of them, but a few of them, they need renovation, and we're presently working on them. If you look at the central hospital today, sometimes some people keep saying, oh, this hospital, yes. But you see the one beside it, it's a 5-star hospital. I mean, that's where my office used to be until I moved.
Hospital?
It's central hospital, but you know,
private,
it's private-public partnership. It's not private, so totally.
Is that supposed to be, sir?
Oh, yes, because like I keep telling you,
health is public health. Just have a good facility like that, a good structure for
that's
health.
What we're doing, and nothing happens automatically. Everything is a process and a system. And
I
so,
hope we get there.
and so, with the goodwill of Governor Obaseki, he's doing that. I'm sure a lot of people are saying that. I see that. I don't know whether because I'm in the system I see it. The man is very hardworking and inspires us all every day. He's our GPS. He directs us and then gives us the path. I don't like to be political because I'm a professional, but when you see good, you have to reinforce. You have to reinforce good. There's a popular saying that if you have a room of intelligent people, most likely intelligent decisions will be taken. And Governor Obaseki is one of those people that I think God has blessed us with, and we should utilize this opportunity to leverage on all that is resources that he can provide and directions he can provide to improve our health status. We are presently planning to build a health hub in Edo State because it's like a conference town.
Okay.
That is already ongoing. The physical structure has been accessed and where it's going to be located. I'm hoping and praying that with all the plans we have in mind, before the end of his tenure, Edo State will be one of the states that will be a beacon of life to other states in the country, based on what we are doing right now.
Okay.
All right, so let's say for people who are already registered with other HMOs, can they still be part of this?
The law says that if you are you have to be under NHIS or Edo State Health Insurance Scheme if you are a resident here. If you are already registered with other HMOs, you would have to come and see us, and then we would have a middle ground on what services we can provide for you. We realize that most HMOs they not do a lot of services like ground ambulance services that were also inculcated into our program. They don't
there's a name you call the package though, the highest.
Enhanced,
okay.
Yeah, but we have ground ambulance services that we have calculated in most of our packages because we have procured some ambulances in the state, and so we are pulling them like an Uber service where you don't have to have one in one spot, so we can monitor where one is, and so that's more effective and then less spending. So in health insurance, we do a form of strategic purchasing that reduces our cost of admin but increases our output. So that's one part. For those who have HMOs, we can sell that service to them and then do a pricing and actuary pricing and get our funding for that. We're also doing telemedicine for them.
What's that, please?
Yeah, telemedicine is like you're seeing a doctor, virtual doctor.
Okay, virtual doctor.
People are having virtual meetings now, Zoom meetings. So it's like a virtual consultation.
It should be an app?
Yeah, it will be an app on our system where you can access most of the doctors 24/7. And then we as an insurance company will reimburse them. You know, there's a typical medical paradigm when you are seeing a patient. You access the patient, you see, and then you touch.
Do checks.
There's a part called examination where you have to inspect, across, touch, and all that, but that's not part of the telemedicine. But when we see that we have gotten to that part and then we cannot move beyond that, of course, a doctor will be deployed to that particular area if it's a rural area, or the patient will have to come to one of our accredited facilities to seek health care. So there's a lot of thinking going through it. It's not perfect.
But it's work in progress.
It's a work in progress. We will continue to develop it. We'll continue to hear ideas from the public and continue to improve our process. I'm sure with what we have and what our thoughts and processes are, it will take traction, and then we'll be a moving train.
Thank you very much. We're almost rounding up, but the truth is, Dr. Rock, I've learned a lot, and I've come to see the benefits of this health insurance, and I'm hoping that people out there will also take advantage. Before we wrap up quickly, a quick message to everyone watching about coronavirus, because people are still not putting on their masks. As a doctor, please tell people it's real and make us understand.
Thank you again. I'm happy, excited to be here. Coronavirus is real. It's as real as you and I. It's here. You can only avoid or reduce its spread by observing those precautionary measures that government has put in place. And by all means, if you feel sick, if you feel ill, if you have a fever, please go to the closest health facility so that doctors can inspect you, engage you, and know the way forward.
Thank you very much, Dr. Rock, for being here. I sincerely appreciate, and I'm really hoping that we get good news, and everything you said, I will begin to see it play out as time goes on. Thank you for being here, sir. But that will be all we can take because of time. There's so much we would have talked about if not for time. Thank you so much, viewers, for joining us. If you are in Edo State, please do want to take advantage of the health insurance scheme put in place. At any state you are, wherever you are, though, please take very good care of your health, and also see that you register with the NHIS or any HMO that's reliable, that you know, yes, can take care of your health when the need arises. Thank you so very much for being here with us. Please do also follow us on all our socials. That's TSL Nigeria TV, and subscribe to our YouTube channel, TSL Nigeria TV. My name is Uzezi Udoife Idehote. We'll come your way again. Stay safe.
Stay connected to TSL Nigeria and get updates on the go all day, every day. Subscribe to our YouTube channel on TSL Nigeria Space TV and join our online family.